topic I want to talk about today is headache. Now, we've all had headaches. They're not much fun. Luckily, they disappear after a while, and often you can fix it with a glass of water and maybe a paracetamol or an aspirin. So the common causes of sudden onset of headache is obviously the simple thing: dehydration, a lack of food, maybe a particular food allergy that triggers headache. A common one is MSG for some people. And then there are the conditions such as an acute tension headache due to muscular tension, or somebody might actually have migraine. And then they may or may not have the aura that comes beforehand, and then they start to have the nausea and the vomiting and the difficulty with bright lights or loud sounds and the headache. So there's different causes of headache, and most of them are going to be resolving over time. I think one of the things to talk about is what happens if you've got a constant headache. How do we define that? What are the causes of that? What can we do about that? Well, we call that chronic daily headache. And it doesn't have to be daily, but we define chronic daily headache as being present for, say, at least half the days of the month. So present for more than 15 days or 15 days or more of the month, we constitute that as a chronic daily headache condition. And there's not just one cause of that. There are multiple causes of that. So a person can have migraine, and the migraine can slowly over time become more frequent. And as it does so, it transforms from what is an intermittent phenomenon to just a constant background headache with maybe little migrainous episodes on top intermittently. So that's one cause of chronic daily headache. Another cause is ongoing chronic tension headache, where there's no migraine component. That can also end up being continuous. A very common cause of chronic daily headache that we see in the pain clinic is one of opioid intake. So if people take opioids, especially if they take opioids for a headache, then the opioid can guarantee a future headache. And they can get into a cycle of more opioids, more headache, and end up with a chronic daily headache pattern. The solution for that is they have to stop taking the opioids. And the headache may get worse for a week or two on doing so, but they'll have resolution of their headache at the end of the day from having taken that pathway. There are also some people who have migraine and they take a particular medication called a triptan to resolve their migraine. And the triptans are very effective for this, but the strange, almost paradoxical thing about this particular class of agents used for migraine is that if it's taken frequently to reverse the headache, it itself can induce a state of chronic daily headache. So people who take a triptan 3, 4, 5, 7 days of the week can end up with this condition. And again, the resolution for that revolves around taking the triptan back to no more than twice per week, for example. So if you end up in a situation where you have got chronic daily headache, please don't continue to try and treat this yourself at home. Generally, it will lead to ongoing nature of that condition. What you should do is seek medical advice, first from your primary care practitioner or your general practitioner, and they may refer you to a neurologist or to a pain specialist. The neurologist is typically very interested in treating those cases of chronic migraine. They possibly might be less familiar with the other types of headache, and they may refer that on to a pain specialist. A pain specialist usually will leave the chronic migraine cases to the neurologist and typically deal with the others. So when we see somebody in the pain clinic with chronic daily headache, we want to look at a whole bunch of factors. We want to look at their posture. We want to look at their neck range of motion. We want to ascertain whether their headache is actually a form of arthritis from the top end of the cervical spine projecting forwards. That will need assessment and treatment. We want to work out if they've got what we call a forward head posture, where the head has moved forward and they've got irritation of the little nerve under the skin called the occipital nerve. And that can give rise to a headache at the back of the head. And that has its own treatment pathway related to that. And if they have chronic daily headache, we need to address the factors that might be helping to contribute to that, such as the opioids, such as excessive use of triptans, and there's a specific treatment pathway in the pain clinic related to how we start to abolish the chronic daily headache, related to certain medications. Sometimes even patients might need an infusion of medication in hospital. So that's a brief run through on headache. It's not something we're ever going to avoid, but the critical thing is if we start to see it coalescing to more and more common, probably that's the time to nip it in the bud by reaching out and getting some medical review and some medical input, look at the cause of that and directed treatment for that.